the name of your product or company is called Dr. Chrono. Give me a short history. When did you start Dr. Chrono?
Sure. Dr. Chrono was started back in 2009. It was started by me, Daniel Givatinos, and my co-founder, Michael Nusimov. And we started it back in New York City. And over the course of the 5 years, we moved out to Silicon Valley about 3 years ago, developing medical software. So just to backtrack a little bit, Dr. Chrono was sort of an idea because we saw doctors using paper in medical settings. We felt like there was a need to sort of change what was going on in healthcare. So we wanted to give doctors technology, and doctors were using paper. So we saw actually our competition as paper. As we progressed in the company, we built a mobile medical records app on the iPad specifically for physicians. Since we started the company, we've had close to 70,000 physician signups to date, enormous amounts of users.
7,000 doctors and how many patients?
Close to 4 million patients using our medical software today. We have a patient-facing app that a patient can use to basically take their medical records. So the way that we saw it is you have your email on your phone these days. You can take pictures with your phone. You have your banking on your phone. You have all this data on your phone, yet you don't have your medical information. And what we wanted to do was enable physicians to get access to that data through their phones and through their iPads specifically, and also through the web. But we also wanted to enable patients to also be able to take that data with them wherever they were.
But how is it protected then?
How secure is it? Right.
For us, we store none of the data on the actual device. So you do need an internet connection, but once you log in, our native iPad and iPhone apps pull that data in real time for the doctor to see it and for the patient to see it. So none of the data is actually stored on the device. And it is bank level encryption as well. So everything is highly encrypted. We take basically every precaution to make sure that the data is secured.
We've got Dr. Belzik sitting here. One of the things he and I and Bonnie have talked about is you go to a doctor's office, you fill out the forms, you go back the next month, you fill out the forms. How would Dr. Chrono help Dr. Belzik get rid of the paper?
We sort of have a full, I would call it like a full experience, encompass the whole patient experience from the beginning to the end. So if you're sitting at home, Dr. Belzik, or you have a patient sitting at home, they can use their phone. So say they have an iPhone, they can log in from their iPhone, select a time to see you, and then that appointment gets basically sent into the scheduling system. Sometimes there's verification if the doctor wants that. So if there's no verification, it goes right into their appointment schedule for the available time slots that the doctor has. Then the patient can fill out forms from home if they want, or they can go into the doctor's office without filling out forms. And at that point, we have a patient check-in app on an iPad as well. So a staff member would hand the iPad to that patient. The patient would fill out all the forms there. In real time, all that data is sent to the staff. So the insurance information, any problems, any medications, any history, all sent to the staff in real time. And then it's also sent to the doctor. So when the patient walks into the back to see the physician, the doctor has all that data as well on an iPad. So the doctor can actually see all that data, flip through it, take all of that data, manipulate it, do whatever they need to do. That actually gets sent to the insurance company. So the insurance companies get that data from an iPad app. And the physician and everybody in their practice see that data as well. Then once the patient comes home, they have access to the medical billing, they have access to the encounter information, they have access to all of that information there. And there is messaging if the doctor chooses to have that enabled, where they can message if the patient has questions about what had happened.
The following month, do we go through the paper thing again?
You don't actually. So what happens is a patient comes back in to the doctor's office, and they're not actually handed a clipboard, and they don't have to fill out all their information again. What happens is they're prompted with all the information they filled in the last time they were there. And if there are any changes to that information, that's where they can make that change. So generally, most of the information doesn't change, but the problem may be different, or their insurance information might have changed. Usually those are the two things they may just have to update.
Now I use
two different electronic health record systems. In the hospital, we use one. In the outpatient setting, we use something else. So is this compatible with different electronic health records, or is it a new type of system?
So we built a completely encompassing electronic medical records, also practice management and scheduling and billing platform. That being said, we do have API hooks, and we also have government requirement standards that actually communicate with other systems when needed. So we do have that option available when people request it.
API hooks, you can interface with other programs.
That's correct. So an API is sort of a way that you enable other software amongst other practices to pull and push data. Any other vendor. So it may be another EHR vendor, it may be a billing vendor, it may be just developers in general who may want to pull and push data. So we enable that depending on if the practice wants that, if the physicians want that. So we configure it based off of that.
No, I think we should
look into it.
Yeah.
So it's free for the patients, Bonnie.
Uh-huh.
As a patient, you're not paying for this.
That's great.
And you mentioned the iPhone and the iPad, but you can use a web browser. So with our Android phones, we can also do this.
That's correct. So we also have an Android-enabled responsive website. So there's something called responsive design. So if you go on your Android device onto a web browser, it renders the same way an app would look. So you can log in and do essentially the same functionality as the iPhone app. It's just not a native app.
And you've got over 70,000 physicians and just close to 4 million patients already using Dr. Chrono.
That's correct.
Rather amazing.
This is going to be expanding rapidly.
Yeah, doctors
Very
should look
rapidly.
into this.
Yeah, call me on Monday.
For sure.
Take 2 aspirins and call him up. So Daniel, where will we find Dr. Chrono on the internet?
So Dr. Chrono you can find at drchrono.com. That's our website. You can also download our app if you type in Dr. Chrono in the iPad or iPhone App Store.
Bonnie, with all the caretaking you give your dad, this might be a valuable tool for you. You should look into this.
Oh, yeah, for anyone who's caretaking. Not to have to fill out paperwork.
Now, one last question for me. The patient side, can the patient use this even if their physician isn't a signatory on that program? You have a patient version and you have a version for the physician. Do I have to have a physician who's using Dr. Chrono in order for me to take advantage of any of the patient software you have?
Currently, yes, but we will be changing that very soon where as a patient, you can enter that data in and manage that yourself, and then also give that data to doctors. So right now it's strictly for physicians and patients within Dr. Chrono, but we're releasing it just to patients as well in the near-term future.
When you do that, will you come back and talk about it?
For sure.
All right, Daniel, I think we're done. Any questions? I think we covered it.
Oh, I think that we're set.
I think you should call Dr. Belzic first thing Monday morning, sir.
For sure, I will.
All right. Daniel, thanks for your time. We'll send you a copy of the interview. Most enjoyable, very informative.
All right. Thank you, guys.
Take care.